I think cancer is a very personal thing. All of you, and many of you who haven't, will be touched by it, directly or indirectly. The advance in science is amazing, have increased the lifespans around the world, double it, but that also increased the chance of you experiencing cancer. 1 in 3 for women, 1 in 2 for men by the time you reach age 80. And many of you want to reach that age and see your grandkids. So cancer really respects no boundaries. It touches all of us, all of you. It really doesn't care what socioeconomic station of life you are. Doesn't matter what ethnicity, what country, what geographic boundary. So I think one of the solutions we have to think about are technological solutions that also are not limited by such boundary. Now, it is a big problem, and there won't be a single solution. But I think as we imagine a future where we live in a world without cancer, we have to think about what technological innovation we can imagine today that can help us address some of the questions and some of the challenge. So let's start out by asking ourselves whether we are doing the best we can for every single patient out there. Coming from MD Anderson, you all know that it is the #1 cancer hospital in the world. We deliver outstanding, superior care. However, you all know that most people cannot come to Houston, Texas. Most people cannot come to MD Anderson to get their care. Most people, in fact, about 90% of the cancer patients cannot get care in the specialty hospitals. Are those patients getting adequate care? In fact, the recent IOM report indicated they don't. There's significant unevenness in quality of care that's being delivered in our country and certainly around the world. There are increasing challenge to access of high quality care, and you all are familiar with the escalating costs of the care. That coupled with an aging demographics, we're all getting older. The population is getting older as a whole in the world. The incidence of cancer will increase. And I think it would not be an overstatement to consider it a true humanitarian crisis that's in front of us. And if we don't come up with the solutions, our entire society would be brought down by it. However, I don't think it's enough for us to think about doing a better job, more efficient job. I think we have to think about leapfrog, way to get ahead of the curve, way to deliver more effective care to more people. Let me see what I was going to say. So how can we imagine to begin to get there? I think one of the first things, again, let's take a problem at a time. We're not going to have a single solution to this complex challenge, but one of the things we can perhaps solve is make sure that the best that we can deliver today, there you go. The best we can deliver to our patient today is delivering to every single patient around the world. I just told you only a very small fraction of the patients from around the world can be seen at MD Anderson. Most of them cannot afford. Imagine a 30-year-old woman diagnosed with breast cancer, single mother, 2 young kids. The only doctor in 100 miles is a generalist. If she doesn't get treated properly, her disease will advance and progress. Society will lose a productive worker, her kids will lose a mother, and she will become a metastatic disease patient. She will eventually end up in specialty hospital like MD Anderson, and we will probably fail to cure her at the end of the day. But if we could just make sure the first time she was diagnosed, she was seen in the hospital, in a physician's office, we can make sure that that physician knows and can afford her the best care. So I think one of the things that we want to imagine is using technology, think about how to change our healthcare delivery system from a provider-centric model to a patient-centric model. In other words, let's not think about coming to see the doctor to get care. Let's think about how to bring the care out there so that everybody can get the best care. At the same time, we also know that today's best is not good enough, so we have to continue to do research, to advance medicine, and we heard about how important funding to science is, because until we keep doing it, we'll always be behind the 8 ball. And then once we identify and discover new and better treatment, we have to have a way to get that best out there again. We have to make sure the discovery is adopted rapidly. There is a statistic that tells us that some of you might have heard, for example, a genomic-based test, mutation in this gene called EGFR, which is identified in lung cancer patients, particularly in non-smoker Asian women who have lung cancer, and if they have these mutations, there's a drug that works very well against it. It's a targeted therapy. And that was discovered in mid-2000, 2005, 2006. And in 2001, statistic in 2010, I believe, the statistic is that there's 12% adoption out in the community. 12%. That's a lot of patients not getting best care. So we'll have to have a different system to make sure the best practices deliver. So what are some of the approach? Well, some of the approaches really that I want to talk about is technology. We already heard from earlier, and I mentioned already, now is a time for us to think about this. There is a convergence of our knowledge, technology. We're beginning to think about how to bring engineering, mathematics, computer together with science and medicines. We're thinking about converging all this discipline and bringing teams together that can do things that we couldn't do individually. And also, there's a culture of being connected, which is a major shift in our society. That wasn't the case 10, 20 years ago, but today, every one of you is connected. And most of us are connected somehow. So how can we leverage that and use that as a way to think about extending our reach to as many people as we can, more than ever before, and expand the way we look at cancer as a disease. Don't just look at the biased population, the only patient that can show up at the medical center, like MD Anderson. That's a very small fraction, and they represent a fraction that doesn't necessarily represent the entire demographic of patient. But that's the population we study. That's the population based on which we advance our medicine. Well, there's clearly sampling bias there. How about let's think about doing a study where it is powered by N of all. Why should we sample? Why shouldn't we study every patient? Because every patient is different. Technology allows us to do that now. We can reach every patient. If we can study every patient, we can learn much more from them, and we can use that to advance our research in a way that the result is more relevant to every patient. Now, I'm getting to the point of something that you probably heard a lot in the public, which is the big data. And what I'm talking about when I say extending our reach by really touching every patient, learning from every patient, and seeing the view of cancer from everyone and every individual, it's about collecting a lot more data than we currently do. It is the big data revolution in medicine as well as in other disciplines. What that allows us to do is have a lot of information, but we need to be able to see all the possible unanticipated connections embedded in that noisy system. That's a lot of data, a lot of noise. How do we see connection that's true? Now, not every one of us, in fact, I know I'm not the Einstein, the Steve Hawkins, who can see connection that is non-obvious. But I think all of us have some ability for divergence thinking, and I think technology can help us amplify our ability for that divergent thinking, to imagine all possible solutions. Don't focus on a single solution that solves a problem. Let's first imagine all possible solutions. Don't be limited by what we're comfortable with. Think about everything that's possible, because then they allow us to take all those possible solutions and adapt it and identify the one that's most suitable, most appropriate, totally personalized to the individual patient. We have to now, that gives us the options to treat each patient as an individual rather than as a category of disease. Now, I'm coming to and then you iterate. I'm coming to the end of my talk, and I'm just going to give you a little teaser. Again, you have heard about all the big data analytic, all the big data revolution out there. Everybody's talking about it. It is going to be transformative. We, like many others, are investing in this area. But I want to tell you about a very specific component within that solution, a component that we launched in collaboration with IBM Watson to develop the Oncology Expert Advisor powered by IBM Watson. Think of this tool as knowledge and expertise on demand, except it is the knowledge and expertise that's tailored to the patient in front of you. And the idea is, with this tool, at every corner of the earth where they have connectivity, the physician should have the ability to get access to the expertise and knowledge that's specific to the patient in front of them, so that we make sure that they stay current on the knowledge, even if it's a paper that was published a week before recommending a new treatment paradigm, it will be in that tool to make sure that they're getting the most up-to-date recommendation, the best practice that apply to their patient, so that we can ensure that 90% of these patients who cannot be seen by a specialist will get the best chance of cure so that they have better outcomes. I think I'm going to end here. So this is really a project where we're taking the first step to try to develop the technological solution that can allow us to deliver the best that we can do today for our patient, but deliver it to more patients and eventually to all the patients from around the world, so that we can reduce the mortality of cancer and reduce the cost of cancer to the society as a whole. Thank you.